A cholera outbreak in some parts of the continent is being persistent, while Ethiopia, Mozambique, Tanzania, Somalia and Zimbabwe are affected. Zambia is buckling under the pressure of an acute outbreak which has killed over 400 people and infected more than 10,000 others. Here at home, 2 new cholera cases have been recorded in Limpopo. We get a greater understanding of the situation with Patrick Otim, World Health Organization, Africa's Emergency Health Officer. Thank you very much for your time this afternoon. Perhaps an overview at this hour at least, the information at your disposal. How are we looking?
Thank you very much, and good morning to all viewers. So in terms of the overall cholera situation within our region, we have 12 countries that have active cholera outbreaks. But if you are considering the whole of the African continent, which excludes 2 countries, that is Somalia and Sudan, so we have 14 countries on the continent of Africa. 12 of them are within the WHO region of Africa. Now, out of those 12 countries, we have 5 countries that you've mentioned that we are concerned about in terms of the trend of the transmission, the number of cases that are being reported, and also the deaths, the case fatality ratio, as well as the capacity of the systems to respond and provide care for the people who need it. So within the first 2 weeks of 2024, we have reported over 10,000 cases and close to 200 deaths in our region. And so far we are really concerned about the situation in Zambia, the situation in Zimbabwe, the outbreak in DRC, the outbreak in Ethiopia, as well as also there are beginning to be signs of an upward trend in Tanzania as well as Kenya. So it's early in the year, but we are seeing a repeat of what we experienced last year. In January at such time, we also had huge outbreaks that were reported, particularly in Malawi, which is still within the southern part of our continent. So a big point of concern at this moment, and we are working aggressively with the countries that I've mentioned to ensure that we scale up response and reverse the trend that is being seen.
What is the relationship between cholera and this time of the year?
So one of the things about cholera, mostly in countries where it's endemic, is the rain season. So in most of the places, once you have rains and flooding, most of the water sources get contaminated because some of the latrines are constructed very close to water sources, and some of them easily get flooded, and this affects the water sources. So it's a very common occurrence that we see in most parts, and also, within the Southern Africa sub-region, this is also the time for cyclones as well. So you have climatic conditions associated with flooding that really predisposes the communities in those areas to these outbreaks. But I must add also that we are seeing a continuation really of the outbreaks that happened last year. So the outbreaks that started from last year have not been contained. So in most of these countries, these are not our new outbreaks. All of them are crossover from last year. And the factors such as low access to clean water and poor hygiene and sanitation prevail in most of the locations where we have outbreaks happening currently.
Okay. We'll get into the poor hygiene and sanitation in a few moments. What is an outbreak, Mr. Otim?
So for cholera, we usually just one confirmed case of a cholera outbreak or of a cholera disease is considered as an outbreak. That is in a location which is not considered to be endemic. We say a country is endemic when there have been at least cholera cases confirmed in the last 3 years, and they have not been imported, so they are locally confirmed. So in endemic countries, then you will expect to have at least this seasonality that I talked about, outbreaks happening at least every year, according to the risk factors that we have described. Now, for some countries, you have, like now for South Africa, what you have talked about, those we have cases that have been classified as imported. An imported case is that the person got exposed in another country, and they traveled and they became sick in another country, so their point of exposure is not in that country. However, if somebody who is within South Africa, for instance, now gets infected from this person and passes it to another person, then we now have a local outbreak established. So it's no longer classified as an imported case, that we have an outbreak established in the country, because there is now local transmission happening.
What is the role of the World Health Organization? Enters your organization to do what?
So if in the time of cholera like this, first of all, we work with countries on a wide range of emergency preparedness and response. But now when it comes to cholera specifically, we are, first of all, at a global level, the secretariat of what is called the Global Cholera Control Task Force. So we help countries in putting in place preventive measures. And we have, at a global level, a roadmap which was established to help countries eliminate cholera outbreaks by 2030. And then in the Africa region, we also have a regional framework that was agreed upon by the ministers of health to help countries work towards the implementation of that global roadmap to eliminate cholera. So in this context, we as WHO support countries in implementing the interventions that are in this roadmap, helping them to develop the capacities that they need to be able to investigate, confirm, and respond to cholera. But we also provide for them technical support. So like for all the countries that I mentioned, we have deployed experts. We have provided supplies for cholera control, which include the cholera kits. We have also supported with acquisition of oral cholera vaccines, which is a very good tool that is required by countries to help in situations where you cannot address the water and sanitation in the short term. So like in Zambia now, we started the oral cholera vaccination on Tuesday.
Mr. Otim, please do forgive the ignorance. Would it not be much cheaper to help countries when you speak of preventative measures? Because one sounds like natural disasters add to the situation, but it falls on fertile ground, the rains, right, because of poor hygiene and sanitation services. And so would it not be much cheaper and more effective for people to avoid being put in such a situation where now you're needing vaccines, now you're needing care, now you're needing this, when this could be avoided? Because it also sounds like it's man-made in some part.
Absolutely. So there's a report that was done by WHO and UNICEF. It is a progress report on water and sanitation from 2002 to 2022. If you look at that report, it shows that really in our region in Africa, only 30% of the population have access to safe managed water and sanitation. That means that when you say there's safe managed water, that means that the water is available at the household level, that it can be got any time that it is needed, and that it is free from contamination. So that is only 30% of the population in our region. So therefore, for us to prevent and stop these outbreaks, we need to increase the access to safe, managed water for all our population. And that means that governments need to invest in access to safe and clean water. So we have what is called a ladder of safe water. We start at the beginning, at the bottom of the ladder, by people who only use the surface water, which is common in most of the areas where we have access now. Then people who have access to unprotected water sources, like some springs that are unprotected. Then the third level are those who have access to, who have limited access to water. That means that for them to go to a protected water source, it takes them more than 30 minutes to line up and get the water. Then you have those with basic access. That means they can access improved water at least within 30 minutes. And then you have those with safe managed water within their homes. So we need to move people from the bottom of the ladder to the top of the ladder, where we have a greater proportion of our population having access to safe and clean water. In urban areas, it's much, much more difficult. And you can see in most of the countries, it's around 30 to 40%. Even in Zambia, I was also looking at the stats, even in South Africa. So my appeal then is for us to stop the reactive posture that we have and progressively address the access to safe water and access to hygiene facilities. You will also see that we have conflicts in our region, and the conflicts destroy the infrastructure. And therefore, in places where you have conflict and people are displaced, they will not have that access. And we also need to address the access to water in those areas, but also really promote peace so that people don't escape from homes. Lastly, climate change is here with us. And most of the cholera outbreaks we have been seeing, they are associated with the adverse climatic conditions. The drought in the Greater Horn of Africa, the flooding and cyclones in the Southern African sub-region. And therefore, we need to mitigate the impact. We need to have infrastructures that are resilient to flooding, and also we need to provide alternative water sources to people during dry season. These are and during droughts as well. So these are very, very important. But I must also add that this does not come cheap. It is expensive, and therefore there must be deliberate investment in that area.
It's fascinating that as some people speak about artificial intelligence and how the world has moved, here we are still battling about a basic need. And so how closely or intimately do you work with the African Center for Disease Control, the ACDC?
So Africa CDC is a partner that we work with very close. We actually have, for emergency preparedness, we have a joint emergency preparedness plan of action for the next 5 years that we are working with them for all the different emergencies that we have in Africa. And we work across the emergency management cycle from the surveillance, detection, preparedness, response, recovery, and resilience. So we work very closely with them. And we have, in the last year, we convened a high-level ministerial meeting for the SADC region in Malawi together in March to try to advocate for both the ministers of health, but also the ministers of water and sanitation and environment, so that we can collectively work at the determinants of health, really, both from the climate, but also from things that like cholera that we are talking about, and help to improve health security within the region. So we work very, very closely in this area.
Okay. Mr. Otim, I do beg your pardon, before we let you go, when you are in some parts of the continent, do you drink tap water or do you drink bottled water? You don't have to name a country. But more often than not, do you drink tap water or do you drink bottled water?
So most of the time, it's bottled water, because most countries, I think, they actually advise against drinking the tap water. So it's mostly bottled water.
Okay.
And I must admit that not many people would have that privilege to be able to access the bottled water. So it's a big challenge.
Absolutely. So you can imagine what people on the ground are actually going through. If you as a visitor are advised not to drink the water that the people in the country should drink. And so is there anything that organizations like the World Health Organization can do to put pressure on some of these departments that you speak of, the water and sanitation departments, environment departments that you interact with in various parts of the continent? What are the conversations that are being had at that level? Because what are the conversations that are being had?
So yes, in the framework of cholera elimination that I mentioned to you about, we work with countries to develop what we call the national cholera plans for elimination. And this is a multi-sectoral approach. And once this is being done, you bring together all the different stakeholders and have discussion. So in the development of these plans, there are immediate term interventions that need to be done, to address provision of water, particularly in areas that have been identified as at risk, or what we call hotspots of cholera. But then there is also an investment case that needs to be built for long-term funding for improving access to water and sanitation. So the discussions happen at that level with the different stakeholders, basically on 3 issues. One is the advocacy to understand the importance of concerted effort to improve access to water and sanitation, which is an investment. It's not a cost, because when we invest in it, it helps to reduce the number of outbreaks that we have. 2 is the issue then of mobilizing resources, because like I mentioned, this is a very expensive venture. And therefore, it's not only about the Ministry of Water, Environment. They don't allocate the resources. It's the treasuries in these countries and the ministries of finance. So they need to be on the table as well to allocate those resources. And then 3rd issue then is the political leadership that is required to drive the strategic direction of progressive improvement in the access to water and sanitation. So those are the discussions that we have, and I really want to encourage that these discussions continue to happen, not only in the time of outbreaks, but that it is done at peacetime. Lastly, for us as the international community and the different organizations, we can contribute to formulating the discussions around this, but we can also continue to do advocacy for additional resources from multilateral institutions to support these governments to do this, because they also have myriads of priorities in country that also need funding. Okay. But also in our small way, because most of us are not funding institutions, we are technical institutions. But when we have the resources, we also need to think of sustainability when we do these interventions, this response, that we contribute to the gradual improvement in access to safe water and sanitation in those areas, so that we progressively reduce on the risk of diseases like cholera and other waterborne diseases.
Okay.